For patients who progress despite the option of therapy, and if they do not have significant comorbidities, and if they are young enough, then they might be candidates for lung transplantation. The age cutoff depends on individual centers. Some have a cutoff of 70, some centers will go as high as 75, and there are even a few patients who are older than 75 who have been transplanted. So the time to transplant patients with IPF, or any condition for that matter, is when the risk of mortality from the underlying primary disease is greater than the risk of mortality from having a lung transplant. When we look at patients as potential transplant candidates, we look at contraindications as well. And there are a number of things, in actual fact, that may constitute a contraindication. Various malignancies, significant other end organ dysfunction, uncorrected or uncontrolled atherosclerotic disease, medical instability, bleeding diatheses, chronic infections with virulent resistant microbes. These might all be contraindications, and the contraindications actually vary as well from center to center. Some centers, especially the larger centers who have greater numbers, might be more inclined to do patients who are perhaps regarded as more marginal candidates at other centers. So the list carries on in terms of contraindications, chest wall abnormalities, obesity, BMI greater than 35, psychosocial issues can be contraindications. Patients have to have a good support system and have to have good rehab potential as well. Relative contraindications are shown here. Age, once again, obesity, malnutrition, osteoporosis, prior chest surgery or lung resection is really not a contraindication these days. And in actual fact, we're taking a good number of patients off mechanical ventilation or ECMO and offering them transplants too. But this, once again, becomes case by case.